Hello YouTube, it's me Justin. Had a video that I uploaded yesterday about someone pulling the race card on me. Kind of wanted to address that video and kind of basically I learned a lot from uploading that video and staying in contact with the person that I had the conflict with. Um, it was an eye opener, I guess, for the both of us, and it made me think of, wow, another topic. Now, my channel is strictly for helping people with recovery, giving advice, helping, give my views and the loss of suicide and, you know, the dangers of self harm. But this one struck me because it just goes to prove in our society we're quick to jump to conclusions and judgment. You know, I saw what I thought was very rude and disrespectful comments, and his assumption to me was, you know, maybe I was a racist. So, after clarifying that and reading some of his um, comments after the fact, I'd like to address racism in the medical field. The two stereotypes that he points out, and it makes a lot of sense because I've been witness to it. Um, First off, most people think when there's a male nurse in the operating room or recovery room, they're gay. They gotta be. They're a male nurse. And you got to deal with the fact of, first off, somebody thinks you're gay, and then you're black. So if you have to deal with somebody that's in the hospital and they're an extreme racist or they hate gay people, um, that's a lot of stress. I mean, they go to school, work extremely hard, put in majorly long hours. It's unreal. I don't even know how nurses can actually take care of people when they work the hours that they do. Because I have many nurses in my family, and my hat's off to them. Literally, not literally, but But to walk into a room to say there's an elderly man or woman that was raised to hate, and they see this, I don't know if he's short, this tall black man nurse. And they say, I don't want him, get him out of here. I want a white nurse. I want a female nurse. That's got to hurt the soul because you're there to help people and you're being judged on your color and you're being judged stereotypically. This guy's got 3 kids. I'm sorry. And from what it sounds like, he didn't adopt them. And I don't know of many gay men that have that many kids by doing the nasty. So with a female, um, I just I want to get some input and hear some stories. If he comes across this video and he shares it to his other colleagues, and I know females deal with female black women deal with the racism and the Indians, the Muslims, I guess, so to speak, doctors have to deal with that type of racism. Now, me personally, if I was a black nurse and a male nurse and I walked in and I was the only one on staff because I'm in a trauma unit and some old man or even young man says, I don't want that effing Negro working on me, I'd wheel his ass right out in the freaking hallway. Let him die, That's personally how I would feel. But they're not able to do that, and they take an oath and they take such a hard beating, and like I said, it's hard enough to have the stress of all the hours that you work and then have that on top of it. So, my heart goes out to this guy that I wanted to strangle yesterday. So, um, You know, if you've got a family member that's old and they're in ICU or whatever, and a male nurse comes in, you know, and if he says, oh, you know, I want a female nurse, just try to talk some sense into him, you know. Like I said, and there are some guys that are so insecure with their own sexuality that they refuse to have a male nurse care for them. Let me tell you something. If your nurse is a man and he is gay, I honestly don't think that he is looking to get any kind of arousement at looking at your dinker when you're hacking and coughing, sneezing, you got a fever, you're diarrhea, sicker than a dog. I don't think he's turned on by that. Sure, he's seen enough dinkers in his life that that one that you got between your legs, he's not thinking about it. Trust me, I can guarantee you that. You know, so that's just insecure nonsense. If somebody's there to help you, be thankful, be grateful. Do not be judgmental. If you are racist, tuck it in your back pocket. Go blab and whine about it to your wife or somebody else later when you get home. But don't embarrass somebody because of their race. Don't demand how dare people go into a hospital and demand, I want a female nurse. You're there because you need their help. And then you get bad treatment. Well, guess what? Nurses are human. You treat them like shit, they're going to treat you like shit. Sorry to say. This isn't a beer, people. It's a Dr. Thunder, the cheapest stuff. Dr. Thunder, because I can't afford Dr. Pepper. And if your doctor's black, let him work on you. He's there to save your life. So I just want to see how people react to this video. If anybody has any stories that they would like to share. It's just funny how things evolve, you know. Like I said, yesterday I was I didn't let it ruin my day, but I wanted to point it out. Wow, somebody pulled a race card on me. But then my compassion comes in, and I realize, wow, this person has to deal with a lot. You know, like I said, I'd be. And one of the questions he asked me if I ever worked in a hospital. Well, I am nationwide certified as a PA, which is called a personal assistant. When I lived in Tennessee for a short time, I took the course and everything, and I'm able to take care of the elderly, personal assistant for the elderly and mentally handicapped. That job, bar none, was the most rewarding job I ever had, and the pay sucked, but I didn't care. And I had 2 patients that, I just loved them dearly. Full-grown men. I had to wipe their butts. I had to give them enemas and stuff, and I could care less. And yeah, I had to freaking help clean them and, wash their dinkers and all that stuff. And, it's weird how you think there's no way in hell I'd do that. But when it comes to working and helping somebody, you don't even think about it. And so, like I said, for you insecure people out there that don't want a man, you think, oh, that man wants my junk. No, he don't want your junk. And, he's got his junk at home to play with. He's got a boyfriend. He's got a couple boyfriends. Who cares? I don't care if, this is going to sound vulgar as hell. If I'm dying and this doctor comes in, I don't care if he's black, Chinese, or white, and he's gay, if he's got rainbow colored scrubs and a freaking dildo tied to his head, as long as he saves my life, then do your thing. I don't care. Stitch me up. Well, if I'm having a heart attack, I don't care if you're in, Ronald McDonald's shoes dancing around acting a fool. As long as you can save my life and you're smart enough, then I got no qualms with you and being gay, being black, being, Muslim. I don't give a damn. So, but this channel here is not for, to bring up racial topics. I don't want a bunch of hate comments on here. I'm not even going to address in my videos about kneeling for the American flag. I am completely against that, but I'm not getting into that topic because I don't want people that are coming to my channel who are down and out, just full of depression and going through recovery, and then stumble across a video that's got nothing but negative comments that is going to pull them down in a deeper place. Now, I refuse to have this on this channel. But I did want this, opened my eyes yesterday, and I was guilty of it, in a sense. Right off the bat, once I found out he was male, it pissed me off, but it's hard to explain. And it's cool that we were able to get through the argument and, like you said, talk civil, and and it popped in my head, and said, wow, the things this guy's got to go through. He steps into that hospital every day after he's worked his ass off, and to learn his trade and learn how to heal people, take care of people, be there as they're, they're scared, the scariest time in the world. Being in the hospital thinking you're going to die, it's not a joyous place to be, but to have somebody that's willing to care for you and put their emotions aside as you jerk your arm from them and call them the N-word or monkey, or, and then for that person to have to keep composure and continue to care for you while your selfish, ignorant ass is worried that he's either gay, or the fact that he's black and you don't like black people, he's not working on me. Like I said, I'd wheel your ass right in the freaking hallway and let you freaking fade off. That's just my opinion, but just because of pure hatred and ignorance, that's something I don't deal with. So, anyways, if I'm not sure of your name, but if you see this video and you've got some stories that you'd like to unload, explain to what little viewers I have, or just share this video and help educate people on what exactly that you do go through on a daily basis. I'm sure you don't deal with it every day, but when you do deal with it, how do you cope with it? And how does it affect your life when you go home? Does it affect you when you lay your head in bed at night? Have you ever had times where you just wanted to call it quits because of all the stereotyping? Do you walk in and feel eyes are on you? People think you're, gay. Do you walk around and say things, just talk about women just so people would, eavesdrop and think, oh, well, that guy's not gay. He's talking about how hot this chick was. Just some questions, some things to educate us. I don't mean us as in white. Now, like I said, I'm technically not even white. The public. People that are looking to get into the career. Even, maybe give them some advice. Even gay men that want to get in the career but are afraid to because they don't want to be, called gay on a daily basis, or I don't know. I don't know what y'all go through. So if you're able to help somebody by, like a chain, pass this video on and then comments. If I see somebody come on there and say, I don't want some freaking black faggot freaking touching me, all he wants to do is look at my junk, then I'm, blocking you, and I'm going to delete that comment because I'm not going to tolerate that, because guess what? This is my channel. I didn't pay for it. It's free, YouTube. Thank you, YouTube. But I've seen some stupid, crazy-ass videos on this channel, or not this channel, but on YouTube. So, anyways, racism in the medical field, nurses, doctors. How do you deal with it? How do you stay morally strong? How do you continue to deal and work with a patient when they're constantly belittling you, and you've put in 12, 13-hour shifts, and you got to go deal with this, 80-year-old man who's basically on his deathbed telling you to get the F out of his room, because of your color, or you're a man, you're a faggot, you're this, How do you all deal with it? How, do you bring that, how do you let go of it? These are questions I want to know. So, and like I said, I give you the utmost respect. Wanted to strangle you yesterday, and now I have the utmost respect. Tossed and turned on it all night last night. So, please like and share. And so other people that have views, positive views, so to speak, no negative talk,